So 3 myths about sciatica busted. So number 1, that can only be repaired by surgery. Sometimes when you have sciatica, depending on the cause, you will need to have surgery to relieve it. But most times through conservative manual therapy or biomechanical therapy, we can actually reduce that. So there's not necessarily always the need for surgery. And once you've had it assessed and imaging done and checked with your healthcare provider, usually running down that course of physical therapy or manual therapy is the first way that you would actually go about treating sciatica. Number 2, that it always comes from a disc. Sciatica does not always come from a disc. While that's a common cause of sciatica, you can have facet joint irritation, you can have biomechanical dysfunction around the lumbar spine or the glute muscles, and you can also have piriformis syndrome, which is a syndrome within itself that will irritate the sciatic nerve. So it does not always come from a disc. Myth number 3, that you should avoid movement. Depending on the type of sciatica, that can be helpful, but we want to restore function to that area. Usually dysfunction, sometimes trauma has caused sciatica. So not moving is sometimes a really bad way to treat sciatica and can actually prolong it. So you always check with your healthcare provider to make sure that movement is actually good for it. But movement can actually be good for sciatica, and sometimes, and most of the time, is a way to actually help treat it. We'll get our patients to do certain exercises to help take the pressure off, certain stretches to help that, and even in clinic we'll actually use certain mobilizations and movement patterning to actually help relieve that sciatica.